Hello, and welcome to our presentation on professional identity. My name is Maureen Weber. I'm a Senior Career Services Advisor at Rasmussen University. And joining me today is Jessica Kultz, also a Senior Career Services Advisor at the university. We are also very fortunate to have Linda Lowry, registered nurse, with us today. Linda is also the founder of Illinois Institute of Nursing Studies, Inc. So welcome, Linda.
Thank you.
And Linda, do you want to tell us a little bit about your background?
Sure. So I was started off as a certified nursing assistant, worked my way up to licensed practical nurse, or LPN, and proceeded into the associate degree program over at Rasmussen College. After graduation, I had every role from emergency room to home health, med-surg tele, navigated into the director of nursing role as well as regional director of nursing. And now I'm the nursepreneur owner of Illinois Institute of Nursing Studies, and I teach the CNA program.
Wonderful. We are so excited to have you here as our expert. So welcome.
Thank you.
We are going to start with a short agenda. We'll talk about the definition of professional identity. We will also discuss Rasmussen University's graduate competencies. We will be talking about core values in the nursing profession, in particular 3, code of ethics, evidence-based practice, and social responsibility, and the roles and implications that social media has in the nursing profession. So Jess, if you want to start us off with the professional identity definition.
Thank you, Maureen. To get things started, it's important to understand what professional identity is as a student learning outcome. The university has adopted the provided definition from the National League for Nursing. That really asserts the attainment of this occurs when a nurse can demonstrate core value, engage in personal and professional development, and gain experience to grow as a professional. We want to ask you, Lynn, to provide some examples regarding the following. What do you see lacking in new nursing graduates as it relates to professional identity?
Sure. So professional identity to me is how you carry yourself at work and when you're not working in order to maintain your reputation. And a lot of that has to do with your work ethic. Your time and attendance is crucial. I grew up with the motto that early is on time is late is unacceptable. You have to show up. You have to be present when you're there. You have to have emotional intelligence, compassion, respect, genuine care. And there's a lot of self-reflection from day one. And new nurses, sometimes they're not able to identify when they don't. Well, for starters, they don't know what they don't know. And sometimes they don't know how to identify their resources. And maybe it's the lack of willingness or confidence to ask for help. In their defense, that sometimes their more experienced colleagues can be unfriendly. There's bullying in healthcare that makes it a little bit hard to approach for a new grad to approach a seasoned nurse. And they really do have to do that because you have to be able to identify when you're in over your head and how to ask for help, and because it's imperative for patient safety.
I like how you wrapped that up to not only some actionable ways for a new nursing graduate to improve upon that, but understanding that fundamentally we're talking about safety here. So, what areas can new nurses improve upon?
Well, they could start with work ethic, okay? And work ethic begins the moment you walk into the door at nursing school, showing up for your appointments on time, making good on your word if you're going to be there at 2 o'clock with your financial advisor, practicing and honing the work ethic, the traits. You want to be friendly, customer service oriented. You want to learn what resources are available to you and how to use them. And I was told early on in nursing school that a good nurse doesn't know everything, but they know how to find the answer to everything. Because sometimes there's not somebody to ask. So it's important that you at least have a good foundation of work ethic. If you show up a half an hour late for your shift, you're automatically going to feel behind. You're going to feel frazzled. So starting these habits in nursing school are super important. And it may seem kind of common sense that you have to show up on time, but common sense is a flower that doesn't grow in everybody's garden. And you need to show up on time. You have to be pleasant. You leave your problems at the door, and and exhibit respect and compassion to all of your coworkers. And that role playing, getting used to doing that with your team members in the classroom is very important. A good learning experience.
I love how you just wrap that right up into bringing it to the classroom. And so, as you know, it really starts this professional identity day one as student nurse.
Thank you.
The National League for Nursing, like Rasmussen, has taken the concept of professional identity, one step further, and has identified, distinct graduate competencies. And so the university has outlined distinct competencies for each of our programs of study. And so the concept really evolves from that practical nursing level of assessing one's individual contribution to the team all the way through to the practice doctorate DNP of embodying what it is to be a nurse scholar. Lynn, how do you differentiate the levels of professional expectations based upon scope of practice?
So the scope of practice that's dictated by the Nurse Practice Act, and in the state of Illinois, I believe that a new nurse, as well as a seasoned nurse, of course, should know what we can and cannot do. That does directly correlate to using our code of ethics to be able to safely deliver care and to be able to take action consistent with the obligation of being a nurse in whichever level you're at. So practical nursing, licensed practical nurses can't do the same thing that nurses can do, but nurses can do everything that a practical nurse can do. And acting with integrity within your level, staying in your lane, so to speak, is important. And again, it's for not just patient safety, but you need the groundwork, like a ladder. It's easier to climb a ladder one rung at a time as opposed to skip rungs, because when steps get missed, then it's easier to have errors, and errors translate to poor patient outcomes.
Thank you so much, Lynn. It's important to understand, certainly, I like how you identified the necessity of staying in the lane, but recognizing what lanes may be for where you're currently at and then where you're heading. So we appreciate your feedback with that. I'm going to pass it back on over to Maureen to go into our core values.
Yes, so nursing core values are fundamental to the practice of nursing. Nurses follow a set of values to guide them in their daily practices. In particular, we would like to discuss 3 core values: code of ethics, evidence-based practice, and social responsibility, which includes the implications of social media in the nursing role. So we'll start off with the code of ethics. According to the American Nursing Association, the ANA, the Nursing Code of Ethics is a guide for carrying out nursing responsibilities in a manner consistent with quality in nursing care and the ethical obligations of the profession. It is a succinct statement of the ethical obligations and duties of every individual who enters the nursing profession. We do have all of the provisions set forth here on this slide. So Lynn, we know that this professionalism starts in nursing school. What should nursing students be doing day one as they start their education and leading up to graduation?
I think that they should know their code of ethics from day one and keep practicing them and utilize and implement them in everything that they do, because they are the bearer of standards. They set the standard for you of how everything that you do is in alignment with it's a bearer of standards, and it helps you stay in alignment with all of with the Nurse Practice Act, with your employee handbook, and your core values, using your evidence-based practice and being socially responsible. It starts off with the code of ethics, so they should know them and keep reinforcing them, because that's how you develop good habits.
Wonderful.
It helps keep you impartial too.
Pardon me?
It helps keep you impartial and unbiased.
Wonderful. Yeah, very important when you're working with patients and family members. So can you talk a little bit about how maybe, emotional intelligence plays into that, following those code of ethics?
Sure. For emotional intelligence, you have to do a lot of self-reflection of what you think you are capable of in the nursing role, because it is an emotional position. It's stressful. It places a lot of demand on the mind, the body, the soul, and knowing what your limits are, knowing, can I work 16-hour shifts 3 days in a row? Do I have to call in? Do I have to leave my team down because I'm too tired? So even though I'm here, I'm not present. So I think that the emotional intelligence is knowing your limits, knowing your boundaries. And sometimes nursing students, they're spreading themselves too thin. They have obligations outside of school. They're working. They have families. They have other stressors in their life. So knowing enough about themselves to be able to step back from a situation and really reflect on what they're doing.
Yeah, I like that, because they're definitely going to be dealing with, family members of patients, with other doctors, with other colleagues, with the patients themselves. So they've really got a lot of parties to communicate with and to stay on top of. So I like that. And I think, too, you had mentioned earlier, really role-playing, showing up for your clinicals, being present, prepared, ready to learn are just huge pieces of that as well.
Yes, you're role-playing from the moment you walk into nursing school. You're practicing good habits, time, attendance, compassion towards your fellow coworkers who are your fellow student classmates right now. But it's a very small world, and the person that you're in class with now could be your supervisor someday. They could be your coworker. They could be a patient of yours. Be nice. Be nice to everybody.
Wonderful. And then also, how does this code, the Code of Ethics, affect students when they're interviewing for their first maybe nursing position?
Well, each of the provisions can be a segue question for a potential employer to ask a candidate what they think about this. So if they've been looking at the Code of Ethics since the day they walk into their fundamentals of nursing class and learn what the Code of Ethics are, they will have a good conversation. They will be able to speak intelligently on the Code of Ethics and sound like they know what they're doing, even though they're a new nurse. And that will help build their confidence level too, because with repetition will come mastery. We're good at what we practice.
Absolutely, and that will certainly carry through in the interview and then in the working world when they start that first position. So, yeah, wonderful. Thank you, Lynn. Jess, I'm going to turn it back over to you for evidence-based practice.
Wonderful. Thank you. So along with the Code of Ethics, a subsequent pillar of the core values of nursing is evidence-based practice, or EBP. Certainly something that our students hear frequently from faculty. And we, as an institution, have adopted the definition as outlined here: appropriate care to patients with the use of current research evidence, clinical experience, expertise, and an understanding of the patient. And have outlined then the steps, the 5 key steps of evidence-based practice: ask, acquire, appraise, apply, and evaluate. Which leads to the following questions for you, Lynn. How does evidence-based practice translate into the workplace?
So similar to when we're children, our mom says, just do this because I said so, without giving us any firm rationale as to why we're doing it. Evidence-based practice provides the rationale to our students and to one another. Why are we doing something? What's our rationale behind it? And gives us, it helps communication when we're talking with patients, peers, teachers, mentors. Why are we doing what we're doing? Because we only learn 2 things in nursing school, and that's how we do it and why we do it. So it's not how it's always been done. There's evidence-based practice that helps let you know exactly why it's being done this way. And it's forever changing too. There's always better ways that we could do something.
I love how you've really painted that evidence-based practice provides the why to the how. So how would you tell a student nurse that they can demonstrate the steps of evidence-based practice? What advice would you provide?
Constantly ask why. If you don't know, don't just do it because somebody told you to. Ask, why am I doing this? Instead of just go ahead and float their heels. Well, why am I doing this? Oh, it's because we want to prevent pressure on the heels in the bed so that they don't get pressure, the resident doesn't get pressure injuries. Oh, okay, now it makes more sense. Now you have more vestiture in this. And now it allows for further whys. Well, why does this break down? Or why don't we use this instead? What's the evidence behind it? What's the rationale from doing this intervention as opposed to this? And so constantly ask the questions. Don't just do for the sake of doing.
I really love how you just shared the importance of asking questions. There's no wrong question, and being inquisitive, and the important role in that inquisitiveness starting from, day one as student nurse, and then throughout their career, really asking and continuing to ask the whys to become a more confident practicing nurse.
Yes.
So the final nursing core value that we want to really drive home today, that 3rd pillar, is social responsibility. And as Maureen outlined before, that really is going into a discussion on social media usage, as today we know that's a fundamental driver of social responsibility, which has resulted in certainly employers, but more importantly, the nursing profession, to identify a social media policy as outlined by the NCSBN, and that, of course, the university has adopted for our programs as well, that really focuses on understanding the necessity of privacy and HIPAA in order to create and maintain then a trusting relationship between the patient and the nurse, and then a trusting relationship as the nurse professional. Lynn, what is your view on social media policy and the impact on nursing?
Well, there's a couple ways it could go. It could go very, very good or very, very bad. And to speak to the bad first, if you are talking poorly about your classmates, your coworkers, you're bullying, you're talking about patients on social media, posting pictures of patients on your social media sites, talking about going out drinking before work the next day. And your coworkers, your friends, your employers, they see your social media. Maybe you called in sick and you were out late last night. There's a lot of you leave your integrity up for debate, okay? And everything that you do should be congruent. You have to take action consistent with the obligation of being a healthcare professional. And now ways that this can go very good is by boosting up your fellow coworkers, pat them on the back in front of everybody on social media and tell them how great they are. Talk about your employer. Talk about the good stuff. Everybody knows what the bad stuff is. Everybody knows that short staffing exists. Everybody knows that there's a cranky coworker somewhere or a boss that you don't see eye to eye with. But talk about the good things because there's enough negative around. Talk about the good stuff. And that's how you get staffing ratios up. Your friends know that you're happy at your job, that there's something good that they're looking for. And that gives them the ability to make a more informed decision instead of just looking at the bad all the time. Instead of bullying, talk about the good things about a fellow employee because that's how you reinforce positive behavior. And it feels good to make someone else feel good. That's why you're going into the healthcare profession.
Oh, I would love that. It's how you can elevate using social media. So the conversation isn't that a nursing student or a nurse shouldn't use social media. It's how they're using it and are they elevating their profession. And I really love how you articulated the way that this use of elevating and promoting your employer, for example, can then impact the things that we frown upon with short staffing or with, other aspects that are not ideal in someone's current situation. So I really love how you've provided what not to do and what they can do to elevate themselves as a nursing professional and how it ties directly to their social responsibility the moment that they start as a student nurse.
It's a powerful tool, and things that you do from the first day that you walk into nursing school will follow you through your nursing career. The good, the bad, the ugly. You get to choose which it is.
And that's just a really beautiful way to wrap things up. On behalf of the university, Maureen and I would really love to thank you, Lynn, for taking time out of your schedule to provide your expertise, not only as a nursing professional and a nursepreneur, but as a graduate of Rasmussen University. Thank you so much.
Thank you.